Hi, Mrs. Smith. I'm super excited that you get to go home from the hospital this weekend. While you were here, you were diagnosed with stress incontinence, and what this means is that your urine is involuntarily lost with increases in intra-abdominal causes, and we aren't entirely sure why this happened to you, but what we do know is that the loss of pelvic floor muscles or loss of fascial support of the bladder and the urethra can play a really large part in this, and also age, obesity, childbirth-related trauma, and pelvic floor surgery can put you at a higher risk for stress incontinence. But the main thing is that incontinence of any kind can put you at severe risk for skin breakdown, so it's super important that we treat this urgently. Incontinence can cause inflammation of the skin, which can lead to redness, pain, itching, swelling, blisters, and dryness of your skin. And when the skin becomes damaged, it's at a higher risk for infection. And also, because of the incontinence, the skin can become warm, which means it's a breeding ground for both bacteria and fungi, which also increases the risk for infection. And so, with this stress incontinence issue, we have prescribed you to tolterodine, and this is an anticholinergic medication. So these types of medications block the action of acetylcholine, which is what activates the smooth muscle contractions. Like I said, it's a medication that treats incontinence and also overactive bladders. And while you're taking tolterodine, it's important to that you're aware of some of the adverse reactions that can occur with the medication. So oftentimes dry mouth happens when taking these types of medications. So if you want, you can suck on like a sugar-free hard candy or take sparing sips of water to help with that feeling. And then also constipation is another side effect. So if you are experiencing constipations and haven't had a bowel movement for a few days, it's important to let us know so that we can put you on a stool softener to help you with those bowel movements and help them stay regular. And so basically that's like all the main information that I have for you. We're going to want to see you back, or your primary healthcare provider will want to see you back in the next few weeks just so we can kind of see how the medication's going and how you're feeling and how it's helping. And then basically, if you don't have any other questions for me, I'm just going to have you repeat the two main side effects back to me and what you'll do if you're experiencing those symptoms, how you'll help fix them or react to them. Otherwise, I think I've covered everything, so if you think of any questions or anything, feel free to give us a call. If not, we'll see you back in a few weeks with your healthcare provider. I'm super excited that you get to go home and get to feeling better.